first we're going to assess for jugular venous pulsations. I'm going to start by looking for the pulsating point near the sternocleidomastoid. I'm going to use a straight edge card, bring it out medially, put a ruler at the substernal notch. This is measuring at 2 centimeters. So this would be 7 centimeters. Normal, you want to measure at less than 3 centimeters, and the JVP less than 8 centimeters. Any greater could suggest heart hypertension or heart failure. Next, I'm going to auscultate for bruits, listening for a whooshing sound with a diaphragm and my stethoscope. Would you hold your breath for 10 seconds, please? All right, take a deep breath. All right, other side. Okay. Next, I'm going to palpate for your carotid artery. This is going to be medial to the sternocleidomastoid muscle. You're going to look for the palpating area, or for the pulsating area. It is present, free of thrills. I'm going to palpate the other side. It is strong. Next, I'm going to identify the landmarks that we're going to use for the rest of the assessment. Starting at the right side, second intercostal space is the aortic. On the left side, second intercostal space is going to be the pulmonic. The third intercostal space is going to be the Erb's point. Fourth intercostal space is going to be the tricuspid. And at the fifth intercostal space, midclavicular line is the mitral. All right. Next, we are going to palpate for any lifts or thrills, heaves or lifts. So I'm going to use the palm of my hand. We're looking for a significant rise, and this is negative. Next, we're going to use the balls of my hands to palpate for thrills. And this is a vibration. I feel none, so this is negative. Okay, so next we're going to auscultate with the diaphragm of my stethoscope in the areas we just marked. This is assessing for S1 and S2. S1 and S2 are present, no extra heart sounds. Next, we're going to use the bell of my stethoscope to auscultate those same areas. S3 and S4 were not heard, so this is a normal finding. All right, next we're going to palpate for the aortic impulse. So we're going to go to the fifth clavicular space, or fifth intercostal space, midclavicular line. It's going to be right here. It is present. The normal is 60 to 100. We're looking for it to be regular, which it is, less than 2 centimeters in diameter. His is about 2 centimeters. Yes. Next, we're going to assess for, using the diaphragm of my stethoscope, listening for mitral murmur. So I'm going to do the fifth intercostal space, midclavicular line, listening to this. No murmur is heard. Next, I'm going to have you sit up. All right, and lean forward slightly and exhale fully. Next, we're going to be looking for aortic murmur using the bell of my stethoscope. Same thing, fifth intercostal space, midclavicular line, and is negative for a murmur.